Okay, we are
Um,
live.
Welcome to Weekly Inkblot, um, Episode 7, The History of Treating Mental Illness. Um, I'm flying solo this week, so um, thankfully a very good friend of mine was kind enough to let me use his video stream to do this. Um, but this week we're just going to talk a little bit about the history of how we have gone about treating mental health in the past, how it was viewed. It's gonna be a relatively short episode. So um, let's see. I did find some of the more interesting references to treating mental health were back in some of the ancient civilizations. Um, let's see. There were attempts as early as 5000 BC to alleviate mental illness using a technique called tree panning. If you're not aware of what that is, um, tree panning is where they cut and remove a small portion of the skull. And this was done, it is theorized for multiple reasons. One, to treat mental health, and two, to, uh, to alleviate pressure on the brain brought on by wounds from battle, things like that. And there is actual evidence that over time they healed, um, leading to believe that it was actually fairly effective in alleviating said pressure. Um, the reason they did it for mental illness was it is theorized that they believed that mental illness was caused by demonic possession or dark spirits, which, if you cut a hole in the head, would allow it to escape and leave the patient more or less unharmed. Um, let's see. Um, and there's an awful lot of that through the ancient era. You have Mesopotamia who tended to do that. Not really so much with the tree panning, but the belief that mental illness was caused by supernatural forces. Um, the ancient Hebrews believed it. Um, the ancient Egyptians were a little bit more forward thinking in that they um, they really tried to engage people with mental illness in doing actual activities, be that, rituals, dancing, painting, um, and this actually isn't all that surprising. The Egyptians were very advanced in medicine, so in general, they had a fairly decent idea about the human body. Um, Sorry, you'll have to forgive me. I'm not used to flying solo, so this is all sort of for me. Um, let's see. Um, Generally, however, it was widely believed that mental illness was caused by displeased spirits or deities. Um, there were an awful lot of records of people who could hear voices, and the people who could hear voices in many civilizations were considered to be hearing the voices of the gods. We know that that's not the case now, but at the time it made perfect sense. So, which is something else I want to bring up. Keeping in mind through some of this, what would be considered barbaric and sort of horrifying to us was to them pretty revolutionary for the time. And I'm sure that there will come a time in the future when they look back at the way that we treat the mentally ill and think that we are every bit as barbaric. You know, so we are going to get into a little bit more questionable territory. Um, let's see. Hippocrates was one of the first to theorize that it had everything to do with the human brain, um, as opposed to supernatural forces. And after that, they had there was a Roman physician called I think it's called Galen. I want to say it's pronounced, um, and he came up with the idea that the body was made up of, well, really your mental health, your entire health as a whole, was based on something that they called humors, which, given what they would do to balance the humors, is not very humorous, but forgive the puns. Um, there were four basic humors in every human, from what they believed. It was blood, phlegm, bile, and black bile, and they believed that varying the combinations is what gave you your personality. Now, what they would do in order to treat the afflictions as a whole and balance the humors was a technique known as bleeding. Um, it was actually later known as phlebotomy, which is bloodletting. Um, Bloodletting and actually induced vomiting were generally how they help to regulate those humors. Now, um, as I'm sure most of you realize, bloodletting is fairly risky, pretty dangerous. Um, and this was done usually using either a surgeon's knife at the time, what they would have used, or leeches. Leeches were used to help maintain that as well. And, you know, I, and it's not like they were so far out of the way when you consider the pain and blood loss would probably have given the patient a feeling of lightheadedness, and their brain's dopamine and serotonin centers probably would have kicked in, giving them the initial high um, associated with blood loss. So they probably weren't depressed immediately afterwards. They were probably just kind of woozy and, you know, but where they drew the blood on the body depended on what humor they determined that you were maybe too high on. Um, sometimes they would get it from your forehead. Um, Sometimes you'd get bloodletting from your legs, your arms. It kind of depended. However, they also did customized diets during this period, which was fairly revolutionary. And a lot of people who have mental illness and have lost a progressive amount of weight will tell you that there are foods that stimulate the pleasure centers in your brain. Most successful diets will include protein for the very important reason that protein actually does make your pleasure centers kick in. So if you're going on, a no protein diet, no carbs, you're going to be miserable. But because of these customized diets, they found that certain food combinations did help. It didn't cure the problem, but it did help. Now, at this point, care of the mentally ill were generally left to the individual's family, unless they were violent and were creating issues. If they were violent and creating issues, they generally put them into prison. But the mass establishment of asylums took place probably around the the 1000s is when they started really starting to make those institutionalized. Um, they also had a tendency to restrain the patients. And, as most people who have mental illness will tell you, restraints are probably more frightening than anything else, especially when you're, afraid of the people who are abusing you. And abuse really did take place in there because the people that were taking care of these people were not qualified to do so. These were generally run by, run-of-the-mill Joes that you see on the street who have no idea how to handle these people. It's just another job for them. So they get frustrated with the mentally ill, and this led to, a massive amount of abuse. Um, the social stigma back then was you hid your mentally ill relatives. You did not let them um, make an appearance at family gatherings. People didn't know that they exist. You found a way to erase them, especially in um, the higher ranking families, people who had a lot of family honor, because you didn't want that reflecting bad on your family. Um, Again, that sounds horrible now, but at the time, that was the widely accepted method of dealing with it, and that is unfortunate. Um, let's see. When we start hitting the 16 and 1700s, that's when we start to see a little bit more of the institutions that we're a little bit more familiar with as people. Um, at the time, asylums were also very big on using, just still very classic medieval techniques of, talismans to ward away the demons. And again, this was still at a time when it was widely considered a spiritual problem. It wasn't considered a mental or a physical problem. Something, you had angered God, you had sinned. There were a plethora of reasons, but all of them, almost without fail, were directly related to whatever faith they happened to believe, or just spirits in general. Um, it was generally acknowledged that up into between the 17 and 1800s, you were lucky to go to a church-run asylum. Most of them had what at the time was considered nicer care facilities. You actually had individual beds. You were not chained to the wall. They still had restraints, but not nearly as much. And you'll find this in a lot of mental health communities, that religion as a whole seems to help a lot of people. And this can be true with the individuals that it really means something to. So, I mean, again, they weren't far off from things that help, and that's the sort of the thing that you notice in a lot of these trends. A lot of them had correct mindsets going into it, but they were applying it wrong. It was still the early days. They still hadn't figured out how it's supposed to work yet. So, when Europe really started making massive amounts of asylums, there was the first one is thought to be in Spain, and this one was known. Really, it took people away from their shamed families, and there were so many problems that resulted in it. It was run by untrained, unqualified individuals. These people did not have any sort of medical knowledge at all, no scientific knowledge, and oftentimes they were treated like animals, really. Um, and it was a really difficult thing, I'm sure, for those poor patients to go through. Um, hold on. Let's see. Shortly in 1547, um, in London, uh, an asylum opened up called St. Mary's of Bethlehem, and a lot of people will recognize the more common term for it of Bedlam. Bedlam Asylum um, was known for its horrific conditions. Um, you'd have patients being put on display for money. You'd have people chained to the walls where they couldn't lay down, but they couldn't stand up either. They'd be sitting in their own filth, um, hardly ever fed. Um, it was really, I mean, to think about what some of these people went through is really astonishing. It really is. I can't imagine getting out of there and ever being okay again. It was a very counterproductive place to be. Um, let's see. Anyway, sorry about that. But Bedlam, however, did spark more facilities to be built in other countries. Some were better than others, and it really just depended on where you went. Unfortunately, between the 1500s and the 1600s, you had a lot of people who were just beaten on for really any reason. I've been saying that a lot. But in the 1800s, there were an awful lot of people pushing for reforms of these places. Um, they they didn't seem to really know how to go about it, but at the time, they started going towards the era of let's see, like the most one of the bigger reforms was Philippe Pinel in Paris, and he took um, one of the earliest recorded institutions, and he decided that perhaps the mentally ill would improve if they were treated with kindness and consideration. And he went a long way to rid all traces of cruelty out of the asylum, and did start to notice a noticeable improvement in his patients. Let's see. We have Ash who wants in. Um, um, let's see. Hopefully we can get Ash in. I don't know if it'll work for her or not, but we're trying, so bear with me here. I'm sorry. Um, let's see. Was in Great Britain, these reforms began to take place in about 1796, about 4 years after Philippe Pinel began this over in Paris. Oh, good. She was able to make it. Hi, Ash.
Holy shit, you're loud.
Sorry.
Thing. No, you did. No, you didn't. That's a picture of you.
Is that better?
Yes. I mean, I just had to turn it down. I just had the volume all the way up. I hope you like that picture of me because that's what you get.
Hey,
Okay.
it works.
Yeah, those are going.
All right, so we're talking about history.
Yes, we are talking about the history of mental health. Let's see, we were talking about some of the ancient ways of dealing with mental health. We've gone through about the Middle Ages when asylums really started becoming popular. And we're a little bit into what they started to do to reform a lot of the horrifying conditions that they had. So let's see. Yes, in 1796, where Great Britain really started to pick this up, and it was run by mostly the Quakers. And they really started to stress the importance of treating everybody with dignity and respect.
Weirdos.
Yeah, I know, right? God forbid we should be treated with respect. But they really did go a long way to try and help get the patients more engaged in stuff like, working, getting out into the world and trying to earn a living, sort of to help boost their own self-esteem, which again, we run across this a lot. They have the right ideas, but they don't follow through.
You're cutting in and out audio.
I hate my audio.
Oh shit. Yeah.
Hopefully it's not cutting out that bad. I don't know.
Like, who are you showing me? Yeah.
Let's see. It really started to become effective. And just when it started to become effective, it sort of just kind of faded out. There was a lot of ethnic prejudice between the staff and the patients, especially during immigration as a whole. So, you have people at the time who really didn't like, the Germans or the Irish, and they would abuse these poor people based on their own race, and it's really unfortunate. And hi, Ash, you're showing now.
I'm real.
You're real. Yay. Dorothea Dix was one of the first in the Americas to really push to go back to those mental health reforms. She had to go through some of this herself because of tuberculosis. And she decided she'd had enough, and it was time to change it. So she started trying to find any way she could to push that button. Having fun there, Ash?
My boyfriend is a dick. Sorry.
Aren't they all?
Hopefully.
David plays 5 foot now.
I should probably tell you I don't like feet.
Oh.
Oh.
Go on. Ignore him. He's
The only priority.
We have a couple of very progressive Austrian doctors. During this period, we have Franz Mesmer, who believed that the body was, it contained magnetic fluid, that it was affected by the planets. Basically what he did was he used an awful lot of what we now know as hypnosis.
okay.
And they called it mesmerism, I guess, is what they...
Mesmerism.
Yeah, mesmerism.
That's a thing.
But at the time, they were put into these big tubs that had iron rods attached to them, and he would try and basically use magnets and psychoanalytic practice.
How do magnets work?
He considered it. Yeah, psychoanalytic practice. He was actually the basis for what Freud started to go into. He started to...
But then got distracted by cocaine, turns out.
Yeah. Yeah. But Sigmund Freud kind of picked that up and went through going into the 3 divisions of the human mind: the id, the ego, and the superego.
Mm-hmm.
The id was sort of your unconscious mind, and it was driven by sex and aggression. And as we know, Sigmund Freud is fairly well known for a lot of his diagnoses being around sexual tendencies.
It don't give a fuck, by the way.
Let's see. Let's see. The superego was both conscious and unconscious. And it was generally trying to deny you what the id was telling you to do.
The ego?
The superego.
The superego. Okay.
And the ego focused both on conscious and unconscious thought, but it was supposed to be the mediator between the id and the superego. So I suppose in a lot of ways, he put a psychological spin on the medieval version of humors. If something was out of balance, you had to find a way to balance it again.
Makes sense.
Right. But he did really go a long way to revolutionizing psychology and talking to the patients and trying to pull out whatever memories were causing a lot of these problems. But that's where we get psychoanalysis and/or talking cures. So the whole point of Freud's methods was to get them to talk about it, to ease them into it, and create what are now known as Freudian slips.
Okay.
Just to try and get a basic idea of what you're doing. You know, what it is you're thinking of. After this, we start getting into the early 1900s, which is where we start getting our modern conception of asylums. Things like electroshock therapy, um, dunking patients into ice water, heavy medications. And again, as we've talked about this before, there were electroshock therapies then. There are electroshock therapies now, but they are very different from each other.
Wait, isn't one called electroconvulsive?
Yes, electroconvulsive therapy is what we use now, which is, you know, the tiny little controlled seizures brought on by electricity to more or less try and stabilize your brain chemistry. This is basically what they were trying to do then too, but with much bigger electric shocks. And again, you get into areas where if people are unqualified and can't and have prejudice against the mentally ill, whatever, it was used an awful lot for punishment. And you get people who are so terrified at the thought of electroshock therapy that when they think about it now, it just weirds them out to no end.
Right, so when they were like in asylums, they would, if they were misbehaving, they'd send to the electro thing.
Yeah. There's an awful lot of history with electroconvulsive therapy that way. Let's see. One of the biggest problems with that is if they were not properly restrained, they could get broken bones. They could
smash their teeth.
Yeah, smash their teeth.
Mm-hmm.
I mean, there's so many things that could go wrong with that. It was deemed not very effective around the late 1930s through the 50s. Electroshock sort of phased itself out bit by bit. But this is
come as a shock to me.
Yeah, this is when lobotomies started becoming popular. And for those of you who don't know what a lobotomy is, much like tree panning, they start doing invasive surgery with your head. And in lobotomy's case, it wasn't just a matter of cutting a hole in the skull, it was a matter of removing and or scrambling pieces of the brain.
The frontal lobe.
Huh?
Not the frontal lobe?
I can't hear you.
The frontal lobe.
Oh, yes, the frontal lobe was traditionally where that was. And it would generally go through the top of your eye socket and start poking randomly. And of course, you do that, it generally produces personalities that are lethargic and sort of like a zombie. But lobotomies existed about as long, up until probably the 70s or 80s. I don't have a specific date for that. But shortly during this time, we see the use of antipsychotic drugs. Valium, at the end of this. So about 1949, we are introduced to lithium. And this is around the time when basically they're saying, throw a drug at it, it'll go away. And lithium was one of the earliest examples of psychotropic drugs, which is what we still use lithium today, as a matter of fact.
Except it can kill your ability to walk.
Yes. Yes, it can. And again, it's because of medications like this that we encourage you to be monitored very carefully. Shortly thereafter, in the 1950s, we find chlorpromazine, or also known as thorazine. And Valium came into play during the 1960s. And most of these, thorazine you still hear uses of. They're still in existence. They're still used. And Prozac was introduced in 1987. And it is currently one of the most prescribed antidepressants to date.
I was also introduced in 1987, and I disagree with Prozac, personally. So, same.
Yeah. But it's something my mother had brought up. She's like, back in the 80s and 90s, it became a lot more commonplace to hear people going to go see therapists.
Mhm.
She's like, you didn't talk about your mental illness as much, but practically everybody had a therapist.
Right.
There and everywhere, you know?
My mom saw a therapist, surprise, surprise, and she used to drag me along, and she would be really freaked out. I remember her having me, like, what's the word? Looked at, talked to, inspected.
Analyze.
Yeah. I was like,
Analyze.
I had just turned 8 when she died, so, like, I wasn't very old, and she was, like, having them do tests on me and stuff, and I'm just like, what? This is fun, but I remember just, like, looking at little pictures on cards and telling the therapist what I thought of it, but, and then I ended up, being in therapy on and off for the past 17 years, but, I'm sorry, I got a phone call. Did you touch on Xanax at all?
We have not touched on Xanax. You're certainly more than welcome to. I don't think I have anything on Xanax at the moment.
Fun fact about Xanax is it was developed, and then about 1 to 2 years later, it was released to the public for, like normal consumption. And I believe it was penicillin that wasn't released to the public for like 100 years after, because they were like running tests on it and stuff and making sure that it wouldn't, kill you. And Xanax is the worst thing ever.
Yeah.
When I flew to Japan a few years ago, I had like an ungodly phobia of flying, and I had my psychiatrist prescribe me Xanax. I had never taken it before. My mom was addicted to it, like she was taking ungodly amounts. And so I asked just like for a really low dose, and I took 1 pill, and I was out for the entire flight to Japan. And it's like 12 hours. Like Xanax is, I'm sure it works for some people. I have personally known a few people that just abuse the living shit out of it, stuff out of it. Sorry, Andreas.
Right.
But yeah, I had one roommate who took Xanax, and she would mix it with alcohol and urinate herself.
Yeah. There's so many risks with some of these medications. Up and until the 70s and 80s, there were actually priests that were allowed to prescribe you medication.
Mm-hmm.
And it was always a crapshoot as to what they gave you.
Prayer and medication.
Yeah, some of it may have actually been medication. A lot of it was just a bunch of stuff that they threw in that they thought would help that caused more harm than good.
Nice. Wonderful. Yeah.
And it's not that they were trying to hurt people. They thought they were helping.
Right. Just like when doctors were prescribing cigarettes, they thought they were helping, and
right.
It was a pain in the ass to quit.
Yeah,
But,
I've actually seen articles from like the early 1900s that say that for mothers with PTSD, they should drink whiskey. It was good for them and the baby.
I mean, I have PTSD, and I'll do a shot of Jameson every once in a while, and for a few hours I feel great, but I feel like that doesn't really necessarily...
It doesn't really fix it. It's still there after.
You just have fun for a while, and then you feel like crap for a while.
Right.
Jameson is great, though. That would be the brand I'd recommend. Above Xanax, for sure, Jameson.
Yeah. One of the other big things that I've noticed is if you're ever wondering if your mental illness is hereditary,
It
there are
probably
a
is.
lot that are. The best way to tell what there is, keeping in mind that words for certain disorders change over time. My
Right.
grandmother refers to anxiety disorders as people who worry a lot, worriers.
Yeah.
You know, she's like, oh, your father was always a worrier. You're a worrier just like he is. Well, that's anxiety disorder.
You know,
We
I was
had
actually
people in
reading.
our family in a letter, refer to one of their other relatives and say that their mother's other came out.
Oh.
This was back in like 1903, something like
Yeah.
that.
Oh, that sounds about right.
I believe, multiple
Victorian
personality
era.
disorder, possibly schizophrenia.
Hold on. Dissociative identity, like that's, I can't say when people say multiple personality disorder. It's like
Yeah.
I don't have it, but it's wrong. Um, Dissociative identity disorder is the proper terminology. I was actually reading the Wikipedia article today about PTSD, and it was talking about how since it serves us on like a biological level. It was talking about how like we're less likely to get to develop PTSD from a fire-related incident because our ancestors were so they were like they had to deal with forest fires and stuff like that like pretty commonly. So like we are actually like it's hard for us to get PTSD from fire stuff.
Right.
And then the theory goes into the kind of war combat that we have today that causes PTSD is kind of a new thing for humanity. So that's why look at the shell shock, if you will,
Right.
and I will.
Shock.
But I thought that was really interesting that can be ingrained into our species. I don't know.
Yeah.
That's
Yeah.
pretty
I
cool.
mean, my mother had brought up an interesting point. She's like, it seems that the more time goes on, the more you hear about people having mental disabilities. And she had said, she's like, I'm not sure if it's because there are more people or just that people are recognizing more that these disorders exist. And I tend to think it's the latter of the two. That
Well, yeah, I
I think
mean, it's not swept under the rug and denied.
different things. I mean, there is certainly the element of hereditary mental illness.
Yeah, I mean, almost all cases of OCD are hereditary.
Mm-hmm.
My dad was a hoarder, and I have OCD. Personality disorders tend to be hereditary. My mom was borderline. I have borderline. Also, I also read in the article too that like parents that have PTSD, like in their the different things they try to cope with it, like can actually give kids the symptoms, which I thought was interesting because my dad definitely had PTSD and OCD.
This was actually there was actually a study done on babies that were still in the womb when for mothers that were around during 9/11, particularly in New York. And there is evidence to believe that the infants themselves developed PTSD from their parents who developed PTSD from the disaster.
Right, because of the influx of chemicals.
Exactly.
Yeah.
So they would get upset and they don't necessarily know why they have these fears and these reactions, but it's because their mothers were going through PTSD while in vitro. They were going through all these traumatic experiences. So, I mean, I really suggest if you're looking for mental illness in your family, look for key phrases. They wasn't really talked about. They're usually very vague and almost vague to the point of stupidity vague. Like if they're talking about their mother's coming out. we've seen letters where the person who had the other was apologizing to her husband for her outburst and saying, I love you so much. She's like, I'm so sorry about my outburst. I couldn't control it. I mean, these are very valuable insights. You can find these in a lot of your family history stuff if you go looking through it. Hi, random boyfriend.
His name's Pat.
Hi, Pat.
Hi, Ellie.
Nice to meet you, sort of.
Arguably.
We were coming up from tennis. Anyway. Go on.
But, I mean, really at this point, it brings us to the present day. And with therapies such as DBT, CBT, and just everything that we've learned, gradually it seems that people are starting to get better at learning how to cope. The social stigma is still there, and in fact, many parts of it still was not recognized as a viable medical problem until recently, and it still isn't in some places.
Yeah, it really still isn't.
Most places in Europe and the Americas do acknowledge that it exists. At that point, you're really looking at more of the individuals themselves.
Right.
But again, it's always so tricky because everybody's mental illness is a little different. My PTSD is not going to be the same as Ash's PTSD.
Nope.
We're going to react to them completely different. And what works for her is not always going to work for me, and vice versa. And I think that's really where the stigma comes across. Everybody's like, well, if it's viable, the same treatment should work for everybody. So, and unfortunately, it doesn't work that way. By the way, to our viewers, yes, this is all being run currently internationally.
What?
Yeah, Andreas lives in Austria.
Huh. Did not know that.
And thank you so much for letting us record on your account. I know it's so late for you, and I feel so bad.
Oh man, what time is it there?
Let's see, they're 6 hours ahead of us, so it's almost 2 for them.
Well, maybe my boyfriend will come say hi in a couple days because he's going to be in Germany. Are you going to be near Austria?
I mean, yeah, from Germany.
But speaking of which, for the most part, we've gone through most of the just a little bit of brief history for you guys on what it is mental health patients have dealt with over the thousands of years that this has been a problem, and hopefully we can get to a point where the methods that we use now are considered barbaric, and it's a simple fix later on down the road. Who knows?
And hopefully, if people still have to do privatized health insurance, maybe the health insurance will cover more than like 10 visits a year. That'd be cool.
It would be awesome if all they ever have to do is like touch you in the middle of the forehead and suddenly you're good. Who knows? We have no idea what the future holds. But the point is that mental illness has always existed for as long as human beings have. And that's what this is all about, is recognizing it, learning from it, and raising the awareness.
Mm-hmm.
For something that has been around for so long, the fact that there is still a stigma on it really needs to stop.
Yeah. I get pretty tired of saying, oh, I have borderline personality disorder, and then somebody's like, oh, you mean, or, why don't you leave the bad personality at home? And it's like, that's not what
it doesn't
I have.
Work that way.
Thanks. Yeah, there needs to be a lot more, I think the important thing to well, besides all the other important things. But this one important thing is giving families resources to understand how to manage somebody that they care about having a mental illness.
Yeah. And I really thought that, DBT and IOP are great for helping families learn how to help their loved ones cope.
Right. But I feel that there should be resources outside of therapy too.
Yeah, there should be. And I think you're right. Therapy is not for everyone. I personally am not big on therapy. I don't believe in paying somebody to listen to my problems. It means more to me when
free mental
somebody...
health, but you get what you pay for.
Exactly. I believe that it helps me more to talk to somebody who actually cares.
Yeah, who actually has some context and
Right.
for
But
who
that's
you
just
are.
me. Therapy does help a lot of people every day.
You see the therapist for an hour a week, and that's what I mean. Like, families need more resources because their loved one is with that person for an hour a week, and the rest of I don't know how many hours are in a week, but probably a lot. And so the person is there for the rest of the week, and the family really needs to have context and stuff.
Yeah.
There's 168 hours in a week. Thank you.
Oh, he totally looked this up?
No, my boyfriend is a math whiz.
I envy him.
Yeah, he just did it in his head right now. Anyway, so 167 hours of the week you're not in therapy, and your family really needs to, have some way that they know, because it's very much a language barrier. Like...
It's its very own language barrier.
Yeah, because I'm feeling sad to my buddy Seth over here is excessively different from when I say I'm feeling sad, because when I'm feeling sad, it's different. I don't know. I'm not going to go into this because the topic right now is history. But moving forward, I think.
Understand what other people are feeling in that specific moment.
Mm-hmm.
And,
just some kind of context for the just understanding. I don't know. There's so much that I can't sum up. I mean, there's like 6 minutes left.
Yeah. But on that note, I'm going to go ahead and bid you all a fond farewell. I have no idea what we're doing next week. Hopefully Emmy will be back from her auditions, and good luck to Emmy. Hopefully her audition goes great.
Yeah, good luck, kid.
We're all rooting for you.
I'm not. I'm just saying good luck. I don't root for people.
You're so mean.
No, I'll root for you if you insist.
But to everybody else, again, we want to repeat, you are not alone. And if any indication from today of just how long mental illness has been around, you have never been alone.
Never.
There is always going to be mental illness. There always has been mental illness. We can get through it. So I hope everybody has enjoyed my little diatribe on the history of mental health. And we'll see you guys next week. Bye.